For now, it is my pleasure to introduce you to our speakers for some opening remarks. First, I am pleased to welcome Finland's Minister of Education, the Honourable Ms. Li Andersson. Ms. Andersson is a strong advocate for school health and nutrition, including the provision of quality, comprehensive sexuality education. Finland also chairs the School Meals Coalition. The floor is yours.
Your Excellencies, ladies and gentlemen, it's a great pleasure for me to welcome you to this side event of the Transforming Education Pre-Summit, focusing on the vital importance of health, nutrition and the overall well-being of school children. As we heard, healthy, well-nourished children and youth learn better and have greater opportunity to thrive. Dear colleagues, child poverty and malnutrition, already worsened by the pandemic, are now coupled with a global food crisis made worse by the rising food and energy costs all over the world. Achieving sustainable development will require investing in education and quality learning opportunities for all. Therefore, the Transforming Education Summit should make a strong call to improve the conditions for learning. We need targeted investments in health, nutrition, pupil welfare services and support for learning. Finland knows the transformative impact of nutrition on learning firsthand. Our over 70-year history of free school meals has had a major impact on equity in education and more broadly on equity in our society as a whole. Finland was the first country to guarantee a free school meal by law in 1943, and today free school meals are offered from pre-primary to upper secondary education, and meals are also heavily subsidized at tertiary level. Free school meal has become a key part of the Finnish education model and of the Finnish welfare society. We believe that nutritious food provided in schools is among the best investments for equity and in the economic and social welfare of the entire society. The benefits go far beyond a plate of food. That is why Finland, together with France and countries from north to south, have been intensely working on building a global school meals coalition. The initiative is gaining momentum as so far already 67 countries and 60 organizations have joined the coalition, and we welcome many more to join. The aim is to ensure every child the opportunity for a healthy meal every day in school by the year 2030. Dear friends, recovering from the pandemic and building a more sustainable and resilient world will require policies that tackle several challenges at once through system-level approaches. We believe that school meals are one of those systemic solutions. Evidence shows that school meals produce high returns in learning performance, in equity, health, social protection, as well as economic and agricultural development. They provide a powerful incentive for the poorest families to keep their children in schools, entire communities benefit and become more resilient. I hope that the discussion today can strengthen commitments to expand school health and nutrition programs globally and convey a clear message for the summit in September. Every child must have the opportunity to go to school, to learn and to receive the care they need for learning, to play and to thrive. Thank you very much.
Thank you, Ms. Andersson, for highlighting what young people truly deserve. I now welcome the Unesco Assistant Director General for Education, Mr. Fania Giannini, who is a strong supporter of the important work within UNESCO focusing on education for health and well-being.
Excellencies, ladies and gentlemen, welcome once again at UNESCO. It's a great pleasure, a great honor to be with all of you here today. We feel everybody very much younger. You know, I was opening the youth forum. I would say that there is a great spirit in the house, in the room, and I'm very much delighted that we can also discuss some very specific, important topics, strategic initiatives, I would say, like this one in this panel, to be discussed, school health and nutrition. Minister Anderson just mentioned the School Meals Coalition, which is one of the positive outcomes from another UN process, the Food Summit, and we are very much looking forward to have some kind of, you know, similar mutatis mutandis initiatives for education. Well, we know which is the real world. I mean, many boys, many girls can simply not go to school or take full advantage of education opportunities all around the world because of many reasons, because of ill health, hunger, poverty, exclusion, to put it simply. And we know also that today the challenge is even bigger, is even more, you know, more important than before COVID-19. We saw so many difficulties that countries have to face during the last 2 years. We were so much cooperating with partners, especially UNICEF, the World Bank, GPE, but also other partners, WFP, who are now today in this room at the highest level, and I thank for that. We really try to support governments, communities, to address this new unprecedented landscape where we are moving on. And with these school closures, 1.6 billion students out of school because of COVID-19. As you remember, students lost access not only to learning, which is an important part, of course, the core mission of schools and education, but they really lost access to other important part of their, you know, right to be children, to be young people who have to grow up, critical health, nutrition support, including school meals, social protection. And that's what we are talking about today. Future learning and decades of economic and social gains are at stake. This is the reality we have. And this means that we urgently need to put health and well-being of children and young people at the core, at the center of our efforts to transform education. You know, the core topic of the process of this pre-summit, the pre-summit as an initiative under the leadership of the Secretary General of the UN is transformation. And we cannot have transformation without recovery first and putting these dimensions within the action plan. And school health and nutrition programs, you know, all represent also an affordable and practical response to this challenge, to the need to transform. As you will hear for sure from the panelists today, there are already very specific, concrete ways in which schools can support learners' health and well-being. Maybe the challenge on this topic, as many others, about transformation in how we can scale up, how can really make good initiatives, strategic initiatives, right? So maybe this is the approach that we have to take together. You also will hear highlights from a new UN interagency report on school health, where UNESCO, my colleagues, I know were leading the process with all the partners here. And this report presents data on how countries are providing healthy schools, meals, vaccinations, and all the other health services. And I'm sure it's very much about lessons learned, Chris, from these last 20 months. And I think that I don't have to preach to converted. We know that the nexus between health, well-being, and learning is clearly an important one. It's a crucial one. If children are not well, if children are not in good health, they cannot learn. And on the other way around is also true. At UNESCO, we are particularly convinced that learners' health and well-being are a cornerstone of a renewed vision for education, and that's why we have to take this opportunity, this unique opportunity we have this year, to put this topic as much as possible at the highest ranking of transformation. And I'm sure that this is one of the main purpose of this panel today. But we also know that the education sector cannot achieve this vision alone. It's really a very good example of how we need a whole government. Ministers here will confirm for sure. Minister Anderson already did. Not only ministers of education, but other sectors being permanently working together, health for sure, environment and others which can create the right conditions. And we also need active engagement from different kind of partnerships. We are not so used in the past to work together so intensively. So I'm very happy to conclude and pleased that this panel brings together leaders today at the highest level from the education sector, health, food, nutrition, and I'm sure that there will be the opportunity to showcase concretely how healthier learners will learn better. I thank you very much, and I also wish a very fruitful pre-summit in the coming days. Thank you.
I now welcome UNICEF's Executive Director, Ms. Catherine Russell.
Thank you very much. Excellencies, colleagues, youth representatives, and friends, I'm so glad that you could join us here today, and I really want to thank the co-chairs from Finland and Namibia. Thank you very much for what you're doing, and all the panelists for sharing their experiences, and of course to Fania for her leadership here. So we're here to talk about an issue that is critically important to the transforming education agenda, and that is how investing in school health and nutrition programs can support learning recovery for every child, which is a critical point for UNICEF, that it really is every child. Everyone here knows that the COVID-19 pandemic has had an enormous impact on learning. It has also confirmed the deep interconnectedness of learning and nutrition, health, and well-being. Before the pandemic, school meal programs supported the nutrition of millions of vulnerable children around the world, in turn preparing them to learn. The pandemic brought the virtuous cycle to a screeching halt. In 2020 alone, nearly 370 million children in 150 countries missed out on school meals due to school closures. The impact of those missed meals is serious, first and foremost on children's nutrition and health, but that's not the only place. It's especially true for children already at risk for malnutrition, and that was a serious problem before, and only exacerbated by what we saw with COVID. In the poorest, most fragile countries and communities, a school meal may be the only nutrition a child gets in a day. This problem has been exacerbated by the impact of the war in Ukraine on food prices, which in turn is exacerbating a global food and nutrition crisis. Missing out on the other nutritional supports that school meals provide, such as iron supplementation and deworming prophylaxis, can worsen malnutrition and anemia, especially for girls. Missed school meals also have an impact on family income. To pay for the nutritional equivalent of school meals can amount to as much as 15% of a family's daily income. For many families, that's simply too much. Beyond nutrition and health, The pandemic has also had a serious impact on child and adolescent mental health. Interruptions in routines, social isolation, and stress are taking a toll. Rates of anxiety and depression among children have grown, further impacting their learning. As schools reopen, we need to recommit to investing in school health and nutrition programs that also support children's well-being. Schools are uniquely positioned to deliver critical services that respond to the unique needs of their students. In many communities, especially those serving the most marginalized, schools are still the only place to access essential services. Excellencies, the summit is the moment when the world must move from commitment to action. We are urging all governments to invest in integrated school health nutrition programs that support learning recovery and help build resilience against future shocks. We especially need strong country leadership and targeted action to ensure that health programs reach those most in need in the poorest countries. To implement these programs at scale, we need to strengthen collaboration and coordination, not only in this work, but in all of our work to transform education. And we need to secure sustained funding and pursue innovative approaches to financing and fostering coordinated efforts. That includes greater investment, financial, human, and social resources in mental health services and psychosocial support. We need to confront this problem head-on and give children the support they need to learn and to grow. This work is more important now than it ever has been. If we are serious about transforming education, we need to transform our schools, and we need to do it now. Thank you very much.
Thank you very much for highlighting the key role that schools have in protecting the health and well-being of young students. I'm now pleased to welcome Ms. Steenkamp, Executive Director at the Namibian Ministry of Education, Arts and Culture, who is also the Action Track 1 co-lead, alongside Mr. Gianluca Grandi for Italy and myself. Ms. Steenkamp will talk about the integrated school health and nutrition in practice. Over to you.
Thank you very much, esteemed Excellencies, ladies and gentlemen. In Namibia, just a very brief outline there is we will look at education in brief so that we see it in context. What were the evidence-based interventions that we've done? And then the integrated school health and safety program that are running across our country in our schools. Also looking a little bit on the Namibian school feeding program, and then our last initiative that we are introducing and that we're working on upscaling and rolling out across the country once more is the Homegrown school feeding program. If we can go to the next slide. So we are a country with 2.5 million people, and we have approximately 1,947 schools, that is 2021 statistics, with 30,000 or 31,000 teachers, and our learners are one-third of the population, more than 822,000 learners, spread across 14 regions. A vast country, geographically, and you must make time to visit. We've got the Namib Sand Sea inscribed in our heritage. The next slide, please. So what is it that we have? We said that we have evidence-based interventions. We have 13. I will just mention quite a bit. In 2013, Namibia did the global school-based students survey. And that showed a number of challenges that our learners are facing in terms of mental health, substance abuse, nutrition, and to name but a few. And you see some statistics there. One thing that is really upsetting is that in terms of sexual behaviors that contribute to HIV infection and unintended pregnancies, you know, we had students with the sexual intercourse during the past 12 months. They were 47.6. We also found that most of those sexual encounters were coerced, and that is really a great injustice that we all know against the girl child and her progress and her dreams and destiny towards a life of education. The issues of mental health became so prominent with COVID, not just for the learners themselves, but also for the teachers. And the teachers were the one constant person in the lives of the learner, and they themselves now had to deal with issues of mental health. So we have, over the years, done quite a number of evidence-based intervention studies. We looked in 2015 also, why are children out of school? We looked at a study. We looked at the cost of inaction if a government does not invest in early childhood education. What are the costs and the foundation skills in terms of numeracy, literacy, a healthy life for a boy and a girl child if we do not invest? And this study revealed the importance of strengthening ECD in our country and the needs and the importance, and I can say with pride now that the Ministry of Education, Arts and Culture will take over from the ages of 4 to 6 early childhood education and not just only focus on the 6-year-old for pre-primary. We're working towards that as STEAMed excellencies. So there are various things that we looked into. We looked into the public expenditure review. Where's our money going? What is it that we do? How do we spend the resources that we have in education? The menstrual health and hygiene management study, child online protection study, that's so important. Children spend more time on screen that we would love them to spend on. And then, of course, the nature and the dynamics of online grooming in Namibia. And we can say with pride that the UN partners have been of great assistance to us in Namibia in this regard. And it's not just studies that we've done, we've acted on them. We've looked at the recommendations, we picked key recommendations, and we acted on them within a given time frame. If we can have the next slide, please. So, this is the studies that I've talked about. We've really looked into the issues of data management in our ministry, disaggregated data, you know, that cuts across. We have a consolidated architecture and functionality of our education management information systems, and all reports are published from 2015 to date. So we believe that our decision-making within the ministry, under the leadership of our Honourable Minister in the audience, that is based on what does the data tell us? What are the evidence that we've documented so far? And how do we improve? Looking at prior experience, how do we move forward using strong evidence in order to get that quality, equitable and inclusive education for all? We may move to the next slide. So you will see, these are just some of the studies that I talked about. We also looked at violence in our schools. And in 2019, we did the survey, Violence Against Children and Youth in Namibia. Can we have the slide? Now, to the issue of school health. School health is something in our country that comes already from before independence. We gained our independence in 1990. But it was really fragmented, it was disjointed, it was for a selective few. And in the 1990s, under new government, the strong focus was on primary health care, school and adolescent health programs, and then outreach programs to the rural communities. And then in 2008, we found that it was just one ministry, you know, who were working really in isolation in terms of school health, and it was really primarily health-driven. And the Ministry of Education, Arts and Culture then in 2013 decided that we want to do a survey. We want to see what are the impacts of various factors on our children's health. And that's when in 2015 we worked together. We signed a memorandum of understanding. We realized the importance of working as a government across and with other line ministries. And we signed a memorandum of understanding clearly stipulating the expectations from the Ministry of Health and that of Education. And on that basis, we developed a terms of reference, a training of trainer manual for integrated school health. Next slide, please. So our school health in Namibia that has been rolled out in 14 regions look first and foremost at a healthy school environment. We have introduced WASH, water, sanitation, hygiene, climate change, and sustainable development. These are all across our curriculum that we have just reformed a few years back. We have school-based health services where we are ensuring that the Ministry of Health do visit our schools for early detection and referral in terms of immunization, specifically to prevent, with the emphasis on prevention, and of course also health promotion. We have the nutrition, as it was said by Ms. Russell, for many children, many of the children coming from very disadvantaged communities and houses where they may not have a nutritional meal. We have the school feeding program that started off already many years back, and it will be reflected as we go in the slide, and we see how we took full ownership of that as a government. The next slide, please. So the school feeding started in the 1991, sponsored initially by World Food Programme. Now we work closely with World Food Programme. As I said, we've got a very good, close collaborative relationship with the UN, with our UN partners. But in 1996, the government of the day decided that we will fully fund the program. And that was an important decision, because it did not only show political commitment and ownership, but it shows really that we were prepared to make a decision to feed the Namibian child. And we now have up to an 80 million Namibian budget towards school feeding. We developed a school feeding policy ratified by our cabinet in 2019, and 80% of our schools we do the school feeding program. 80%. We've reached more than half of the learners. It is regrettable that, Your Excellencies, we are still in a process where we have to see how do you feed the child that came with the school feeding program from pre-primary up to primary level. How do you assist the child without labeling and without adding, to any sense of stigma? Because that's what labeling does. How do you extend that to still maintain the dignity of that adolescent in secondary? So that is still something that we work on and that we look into also in terms of the finances. How do we do that? And on that basis, we've developed our policy. So the National Safe Schools Program also, the National School Feeding Program, it is an essential safety net because we ensure the children come to school. We ensure that they learn. We ensure that they remain in the school, that they are not just psychologically present, but that they are well and that they can interact and grow. And that's what we want for every single child. The next slide, please. So we want to diversify our meals. Our meals, is designed to provide school learners with safe, diverse, and nutritious food. Now, many of the schools, our aim was then to work with local smallholder producers. We have to acknowledge that many of our solutions come from the community, and that we must not underestimate that which the smallholding farmers can bring to the table. So how do we go about sourcing from them for the schools? So we have the homegrown school feeding that we've just introduced. It's targeting the school children, working very closely with smallholder farmers. We've committed funding to that. And the idea is not just to stimulate local agricultural production, but also really to reduce the poverty levels within a community and also create an employment for the vulnerable and disadvantaged communities. And we do this through a multi-sectoral intervention, working again across tertiary institutions, line ministries, different boards, excuse me, and of course with the corporate entities. So we've decentralized to the 14 regions the procurement at a school level. So we are now piloting to give schools direct money and also decision-making powers. It's not always easy because you need to capacitate, you need to engage, you need to guide and provide them with that sense of empowerment. We have regionalized our costed school menus. We've piloted it now in 7 of our 14 regions. And this year, this means that they have meat or they have chicken or they have fish or they have beans or any other nutritional means in addition to what we have usually provided for. So now we are in a process of again committing domestic resources to scale it up and roll it out to other 7 regions in the country. Can we have the next slide, please? Oh, I was just warming up, and regrettably, ladies and gentlemen, I have to end it there because we have other speakers, but we sincerely thank you for giving us as Namibia the opportunity to share this also with Finland. We've got very close, friendly collaboration coming over 150 years with Finland, and what an honor. Thank you, Madam, that you are joining us today.
Thank you, Ms. Steenkamp, for sharing your experiences, challenge, but also the key learnings from your context as well in Namibia. I am pleased to welcome Kwanish Altinbekov, Mr. Altinbekov, General Director of the National Center for Mental Health in the Ministry of Health at Kazakhstan, who will be talking about the importance of mainstreaming learners' mental health and psychological support in education. Over to you.
Добрый день, глубоко уважаемые участники пресс-саммита. Good afternoon, dear participants of the press-summit. Обеспечение здоровья и полноценного питания наших учащихся – это важнейший приоритет для Казахстана. Задачи страны в настоящее время включают обеспечение бесплатным школьным питанием учащихся начальных классов, разработка возрастных стандартов и инструментов обеспечения здорового питания детей и дальнейшее совершенствование школьной медицины. Я являюсь руководителем Республиканского научно-практического центра психического здоровья структурного подразделения Министерства здравоохранения Республики Казахстан. Уже более 30 лет наш центр координирует национальные усилия по улучшению психического здоровья населения. В своем выступлении я хотел бы поделиться опытом Казахстана по продвижению психического здоровья и благополучия учащихся. В ответ на высокий уровень суицида среди подростков правительство Казахстана поддержало инициативу ЮНИСЕФ и Министерства здравоохранения о проведении национального исследования. Исследование выявило высокий уровень распространенности проблем психического здоровья среди школьников и молодежи в целом. С привлечением международных экспертов был подготовлен научно обоснованный пакет рекомендаций и представлен на специальном совместном заседании парламента и правительства Республики Казахстан в 2014 году. Результатом стала реализация национальной программы, сначала на основе широкомасштабного пилота, а затем на страновом уровне, а также рост количества неправительственных организаций, специализирующихся в вопросах психического здоровья учащихся. Программа укрепления психического здоровья и превенции суицида среди подростков основана на всеобъемлющем подходе, включающем 3 основополагающих стратегии. Универсальное продвижение знаний учащихся о психическом здоровье, снижение стигмы и барьеров к получению помощи, селективную профилактику для выявления учащихся группы риска и 3, индивидуально показанное для обеспечения готовности служб здравоохранения и психического здоровья к перенаправлению учащихся. Обучению подростков о том, что такое психическое здоровье, значительно повысило уровень самообращений учащихся. Повышение знаний персонала школ о психическом здоровье привело к снижению стигмы и выявлению учащихся, нуждающихся в помощи. Использование скрининговых инструментов строго с согласия самих подростков и их законных опекунов позволило выявить и оказать значительному количеству подростков, не только имеющих проблемы психического здоровья, такие как стресс, тревожность, депрессия, суицидальное поведение, но также выявить учащихся группы риска, подвергающихся насилию, в том числе сексуальному. Для оказания более качественной поддержки школам на уровне перенаправления учащихся с риском проблем психического здоровья была внедрена программа обучения врачей общей практики и специалистов Центров психического здоровья. Пандемия COVID-19 поставила новые вызовы для защиты и укрепления психического здоровья учащихся в условиях дистанционного обучения. Для проведения быстрой оценки совместно с Министерством образования и науки и ЮНИСЕФ мы разработали и реализовали национальный план мероприятий. Помимо обучения и разработки методических материалов, были созданы веб-сайт для оказания дистанционной психологической и психиатрической помощи, YouTube-канал с информационно-обучающим контентом для психологов школ, родителей и учащихся. Оценка программы показывает, что крайне важно стремиться к укреплению и защите психического здоровья и психосоциального благополучия учащихся. Для успеха требуется политическая воля, межсекторальная и мультидисциплинарная работа. Приоритизация вопросов психического здоровья значительно повысила статус и потенциал школьных психологов, способствовала не только улучшению показателей здоровья учащихся и снижению уровня суицида среди подростков, но и улучшению результатов обучения, отношений между родителями и детьми, учителем и учащимся, снижению буллинга среди детей. Благодарю за внимание. Thank you very much.
I am welcoming my colleague, Jaime Persik. Mr. Jaime Persik will show you how Argentina is ensuring that school health and nutrition curricula address gender, equity, as well as inclusion from a sexual and reproductive health perspective. Over to you.
Good morning, everyone. Education for and in human rights. Building new citizenships and the school as a place of care. Taking education as a human right as a starting point, and within the framework of this pre-summit that pushes us to work towards a common agenda and transformative education, I will address several of the points that were requested of me to share some reflections on the Argentinian experience to rethink education in and for human rights and the construction of new democratic citizenships. I will refer to the following points in particular: schools as places of cooperation, care and change, and an environment for the promotion and protection of health and human rights of children. Then I will make some comments on healthy food and nutrition as a basic human right and a necessary condition for overall well-being, growth and learning for children and adolescents. Finally, I will refer to comprehensive sexuality education in Argentina, which include a focus on gender, perspective, equality, and inclusion, with some references to sexual and reproductive health perspective. In the first place, education is a basic human right as the foundation for the construction of democratic citizenships in school. Education in and for human rights is a commitment and the mandate of our democracies. It is the expression of a political decision linked to the construction of new citizenships in schools. Far from the homogenizing visions of the 19th century, we believe that 21st century schools should promote equality, inclusion for all, while valuing diversity. It should be a place of care and the promotion and protection of rights. Issues related to human rights are the backbone of our democracy and constitute an agenda in permanent construction. Our national education law, approved in 2006, is to generate democratic reflection and attitudes and to defend the rule of law and the validity of human rights. From that point, we conceive human rights education as a comprehensive policy that runs through educational policies developed by the Ministry of Education. Education in and of itself is a human right, and schools are a door through which to access and guarantee other rights. Knowledge about rights as cross-cutting curricular content, and in the third place, human rights education as transformative or institutional practices. Schools should be part of citizenship formation through the recognition and broadening of rights. For this, processes of reflection and learning around the current rights agenda should include human rights as historical social constructs, human rights education from a social educational perspective that seeks equality from a gender perspective, comprehensive sexuality education, interculturality and sovereignty, and the guarantee of children, adolescent, and young people's rights and well-being from a comprehensive perspective on care of one's own health and that of others, the environment, and sustainability. In this sense, one of the principal objectives that we have in Argentina is the construction of inclusive, quality schools that prepare children and adolescents for today's world, for life in democracy, a culture of work, and for personal development. This requires us to build schools climates based on respect for others and for our differences, the construction of identities and futures that promote solidarity and respect, equality, freedom, the possibility of reaching agreement, cooperation, and care. Each time we mention the word right, we have to think of budget and financing. In second place, the school as a space of care, of articulation between health and education. The school is one of the first institutions that builds links between children and their families with the state and with life in society. It is a space of care because it promotes and protects rights within a comprehensive system of protection of the rights of children and adolescents. In a broader sense, we can understand care as a term that recovers knowledge and certain practices conducted in schools that take them on, such as personal care and the promotion of autonomy, the construction of relationships that involve concern for others, and interpersonal bonds. Although schools often point out that caring is not educating, caring practices are indeed part of the work of education. This includes caring for one another, teaching to care for oneself and to care for others. The paradigm of comprehensive protection of children and adolescents expresses a process of recognition towards this group that was built throughout several decades during the 20th century. Over the last few years, and in line with the Convention of the Rights of the Child, the criteria for integral protection has been progressively implemented through initiatives oriented towards enhancing processes of inclusive education of children and adolescents in the most vulnerable situations. This is reflected in diverse public policies, plans, and educational programs linked, among other things, to the integration of new technologies in the classroom, the promotion of reading, access to play and recreational proposals in school, and the creation of educational context for digital platforms. On the other hand, I want to point out that since the foundation of modern educational systems until today, schools have managed to overcome important crises and social transformations, serving as places of meeting, safety, care, reunion, solidarity, teaching and learning. Recognizing the strength presents us with the challenge of working together to find consensus that values these roles in the context of new scenarios in the contemporary world. The upheaval generated by the COVID-19 pandemic has put questions about life in society at the center of our debate, as well as the collective dimensions of care and the role of the state. In Argentina and other parts of the world, a consequence of the pandemic has been the partial or complete disengagement of many students from education. To address this, the Ministry of Education created the program, which is key, and it seeks to invest a budget to make sure that all children have their place in schools. The context of sanitary emergencies and the policies implemented have modified the approaches and interventions of educational institutions, presenting new challenges. This way, the pandemic and its cross-cutting impacts have led us to reconsider the conditions for teaching and learning in another way, including the institutional architecture and ways to accompany children, young people and families by installing a reformulation of the school format. Within this framework, the question of the social function of schools has been renewed as a result of the dynamic and invites us to ask ourselves, what effects has the pandemic generated for the subjectivities and attachments of children, adolescents, and young people? How can we bring them to school and accompany them there? How to teach while caring and how to care while teaching? What can schools do to put the suffering, pain, and loss experienced into words? Thirdly, school health and nutrition. Food and nutrition as a fundamental human right and a necessary condition for the overall well-being, growth, and learning for children and adolescents. In Argentina and in other parts of the world, the situation has worsened by the pandemic, and the continuous demand of services of food and schools cannot be unlinked to the already existing social preoccupations. Food and nutrition are vital human rights. I reiterate, each time we say right, we must think of budget. It is a necessary condition for children and adolescents, and food and nutrition is also indispensable for access to other rights, such as health, learning, and general welfare. School canteens should be considered as a pedagogical space within schools, fundamental places to implement healthy eating strategies and care practices. In our country, the services of school food has a long story and refers to 2006, when for the first time in our country was the cup of milk. In 2014, a budget was included in a specific part was included in the budget, because the low intellectual was linked to bad nutrition. Since 1980, school canteens have been present in our schools, and now each provincial and jurisdiction has to take in charge the school nutrition. It is essential to include potable, drinkable water, and to coordinate intersectoral actions to guarantee these rights. An integrated approach can link us to good nutritional practice and promoting rights. Relating to comprehensive sexuality education, over the past few decades, we have experienced a set of social, political, and cultural transformations that mark new horizons for life in society, in which equal treatment and opportunities are reality for all people. In Argentina, in the year 2006, the Comprehensive Sexuality Education Law was approved, and the way in which it came about is part of these transformations. CSE, as a public policy, represents the search for change in the egalitarian construction of subjectivities characterized by broader notions of citizenships, rights, gender, and sexuality. Comprehensive sexuality education proposes to ensure the right to health and equality for all, in which each person has sound and relevant scientific knowledge, and promotes social relationships in schools that are marked by gender equality. It is also strengthened as a pedagogical tool for the prevention of problems linked to health, as understood in a broad, comprehensive perspective, both in accordance with the frameworks established by the World Health Organization and by Argentina. CSE is a comprehensive policy based on the value of gender equity. It implies also recognition of and respect for diversity, which in turn requires us to challenge the concept of tolerance and differentiate our aims from it. CSE accompanies these pedagogical challenges as a policy for vindication for the differences among rights holders as part of building, teaching, and learning how to view life. These views must value the pedagogical recognition of differences as a basic principles of life in society. This means recognizing the tension that exists between the equality of all people, but at the same time, the differences inherent in the conception of human rights. We people are both equal and different at the same time. The building of better and stronger bonds starts with the celebration of differences. To consider practices of care related to sexual and reproductive health, it is important to question what it means to know oneself and to care for oneself. From the perspective of CSE, to speak of care is to refer to knowledge about and use of contraceptive methods and the prevention of sexuality transmitted diseases. But it is also to have knowledge of oneself and of one's own body, to respect one's own privacy and that of others, to honor one's own choices and those of others, to have the possibility of talking about one's desires and fears and matters related to sexual and reproductive health, all while framing these issues in the promotion of values and attitudes related to solidarity, love, respect for life, and the integrity of persons, and the development of responsible attitudes towards sexuality. To conclude, I would like to emphasize that schools are gateways to learn about, ensure, protect, and promote rights. They are spaces to deepen one's understanding of their relevance and to build visions of the world that prioritize the defense of rights for all and the value of the life we share. Thank you very much.
For highlighting the importance of comprehensive sexuality education and taking an intersectional and also a human rights approach to having this implemented. I'm now pleased to welcome Maria Josie Rojas, Deputy Director of the School-Based Programs Division at the World Food Programme. Ms. Rojas will talk about the transformative power of school health and nutrition around the world and will share with you, for the first time ever, the highlights of the global report on school health and nutrition. Over to you.
Thank you very much, and good afternoon to everybody. It's actually a great pleasure to speak now after all my colleagues in the panel, and to observe and testimony that we're actually all working on the same direction. And if we really want to transform the education system, it's such nice to see that it has come the moment in which we are really investing in the learner and not only on the learning, which is, for me and for us in the work that we do at WFP, together with the other agencies, is just massive and impressive, and it is exactly where we should go. Listening to the examples that we have received here today, it is also extremely rewarding to see how countries themselves, and these are just examples of them as I will walk you through some of the highlights of the report that we have been developing together, on how these countries are already investing in establishing policies and framework to ensure that all these changes take place and happen and secure the well-being of the children that are actually attending the school and getting the access to the education system. It is also extremely rewarding to see how we are investing in the provision of healthy services, and the same thing of school meals, ensuring that they have access to nutritious food to ensure their health as well. So the provision of all these school health and nutrition packages in any way and form is exactly where we are observing we're just moving and going. And it is extremely impactful to see that that is exactly the agreed way and destination where we want to actually land. There is no precedent to what COVID-19 has left, but it's even getting worse with the rising global food crisis that we are all aware of. So more than ever, it's really needed to step up and look at this type of interventions as a way to solve and address many of the issues that we are facing and the challenges that we have today. The Transforming Education Summit calls to leaders from northern and southern countries to lead to urgent actions and significantly improve the socioeconomic, health, and nutrition status of children. Within the Action Track 1, we have been discussing at length the importance and the relevance of the school health and nutrition interventions, and we've come to the conclusion that it's a must to prioritize the establishment of these type of services if we really want to contribute at addressing and transform the education system as it stands today. As Fania was mentioning, together with many other UN agencies, such as Unesco indeed, WHO, FAO, UNICEF, GPE, World Bank, the Research Consortium on School Health and Nutrition, and the UN Nutrition Secretariat, we have been developing a report. Is the first one that collates data and provides evidence on school health and nutrition intervention. So I am the lucky one to walk you through some of the highlights from this report that should be finalized by the fall. But today we already have some data and figures to share that are actually sustaining what we have just heard from our colleagues in the panel. So if we can just go to the presentation. So we'll leave you with 6 messages. Okay, so we start with the first one, in which we do know that health, nutrition, and well-being of learners are key determinants, as actually from Finland we just heard at the beginning of the session, for the education outcomes and integral part of the quality education. In terms of figures, what we know already is that because children are sick, we know that we have already lost 500 million days of their attendance to school. That means that they're not going. And if those that go to the schools, we can reassure that they're not learning, because either they are hungry, or they are ill in any form or way. We have also learned that the provision of school meals attracts children to go to school. And so there is an increase on the enrollment rate of an 8%, and on, also on of the attendance rate, it comes to an average of 9%, meaning that the fact that schools are providing school meals is an incentive for the families to send the kids to school. We have also learned that there is an important reduction of anemia when in girls by 20% where they are having access to nutritious fortified meals. When wash services are provided in school, we can see a 61% reduction in absenteeism in low-income countries. So as we can see, there are just few examples on why school health and nutrition programs need to be a priority in the education sector. We won't change or achieve the objectives of or address the learning crisis if we are not taking care of the children that are ultimately performing the education system. The second slide, next, thank you. So the second message is that I also wanted to give some good news. And the good news is that, again, we are really walking on the right direction. We already know that school health and nutrition is one of the most widely implemented approach to delivering health and social protection. Definitely, it varies depending on the country and the context in which we are. But in some shapes, in different formats, the provision of these packages is actually implemented in most of the countries. Globally, 90% of countries have some form of school health and nutrition programs in place. Many national programs have already implemented practical and affordable intervention at scales. For example, more than 100 countries have school-based vaccination programs. More than 450 million school-age children are dewormed every year in school in low and middle-income countries. And almost every country includes education for health and well-being in its curriculum. School feeding programs are the world's most extensive social safety net, providing school meals to almost 1 in every 2 children in primary school. The third message, as we move forward, is yes, we are doing and we're moving on the right direction, but we do need to do more. We know that only 51% of countries globally provide school-based mental health promotion and prevention programs. Of those, only 24% of low-income countries include these services. For school meals, it's a similar scenario. The gap is greatest where they are need the most. So in the low-income countries, the gap is bigger. We know, in fact, that 78% of children in high-income countries receive meals. Only 20% of children in low-income countries have access to these programs. School-based vaccinations are also more common in high and middle-income countries, and therefore there is a need to strengthen our efforts to ensure that those that need it the most are actually the ones that we are reaching. Next slide. With this comes the need to pay more attention to the school environment, which is critical to the health and learning. Access to safe water, sanitation, and hand-washing facilities in school is essential for learners to practice hygiene behaviors, to prevent illness, to enable girls to participate in school during menstruation, and to ensure that schools remain safe during disease outbreaks. However, almost 1 in 3 schools in the world do not have safe drinking water. Here again, children and adolescents in low-income countries are the least likely to attend schools that have these basic services. Globally, fewer than half of schools have adequate infrastructure and facilities for students with disabilities, including accessible toilets. There is clear evidence that children and adolescents learn better in schools that are safe and inclusive, but school violence and bullying are common in all countries, affecting both girls and boys, and coverage of school-based violence prevention program is low. Next. So strengthening coverage and impact requires programs that are comprehensive, responsive to context, and sustainable by policies and, as you were saying, financial commitment. So policy and financial commitments are necessary to sustain comprehensive programs. Many countries have policies related to school health and nutrition, but few national policies take a comprehensive and multi-sectorial approach to school health and nutrition. One example of the power of political and financial commitment is the significant expansion of school feeding programs over the last decade. 80% of countries now have school feeding policies in place. 90% of the cost of these programs come from domestic funds. Countries are investing on their own programs. The number of children receiving meals grew between 2013 and 2020 by 9% globally and by 36% in low, middle-income countries. Next. Finally, school health and nutrition programs are a cost-effective investment, feasible in all settings, and deliver significant development gains. School health and nutrition programs are cost-effective investment because they benefit multiple sectors. We're not talking about only the nutrition of the kid. We are also talking about the impact that is generated in job creation, in the agriculture, in local economies, in the education system, in the health system. It's a multiplier factor, the investment that you can get. We already know that by investing in $1 school meals, you get a return of $9. Even more, we know that when you invest $1 in mental health, you get a return investment of $21.5. Despite this, and this comes a very interesting point, we know that only $2 billion worldwide are invested each year in addressing the health needs of school-age children and adolescents, when $210 billion are investing in educating this age group, so infrastructure, curriculum, teachers, so that the learning gets a $210 billion investment, the learner is getting $2 billion investing. So then the question comes naturally. It's like, are we really balancing things? Are we investing in the infrastructure, providing all the services, but then we don't have children that are actually going to school because they are hungry or they are sick? So we need to start why this is extremely important to provide infrastructure, definitely. We also need to ensure that the school health and nutrition services are provided in this platform that are the schools. So just to conclude then, in the past months, when we start working towards the Transformative Education Summit among different partners and countries, the discussion has served to come up with some very specific and cost-effective solutions that are backed by evidence. And this is few of the evidence that we wanted to share to you with you today. Where we're talking about this type of intervention, the school health and nutrition type of intervention, we're talking about definitely there are different forms, but somehow they need to include homegrown school meals type of services. We're talking about water and sanitation, talking about micronutrient supplementation. We're talking about vaccination, so specifically for low-middle-income countries, malaria control, deworming, menstrual hygiene management, nutrition and comprehensive sexuality education is needed. So any type of package that includes some ways and some forms of these services is already helping countries to move forward. We are definitely, by using this type of program, investing in the human capital of each one of the countries. So this integrated package, which is also designed to tackle some of the most important barriers for girls, is especially urgent now that we are entering into a massive and global food crisis that will be disproportionately affecting school children for years to come and lead to raising level of poverty and ill health. Joint initiative such as the School Meal Coalition, which, as you were just saying, counts with more than 65 governments already in the lead and more than 60 partners joining those efforts, are a good way forward to ensure commitments from countries, northern or southern, there's no difference that we're talking about here, to massively scale up school health and nutrition intervention, cross-sectorial transformative investment for more sustainable food system and effective education. The Transforming Education Summit is the perfect platform for partners and government to come together and make sure we are transforming the education system to care for the learning and the learner. Thank you.
Thank you for sharing those 6 key messages, but also drawing back on some examples already provided by some of our speakers today. We are now going to hand over in the next 10 minutes to our audience in the room. We would like to have your feedback, so don't hesitate to take the floor. There will be a microphone that will be passed around the room. Over to you.
Thank you very much. I'm Douglas from Zambia, Means of Education. My colleague from Namibia, I think you talked about this feeding program. Yes, I was in Namibia, I think in the last 6 months. I'm not quite sure, and the last speaker there, how you are calling up on all of us to invest in health and nutrition. I hope you colleagues will not going to be fed up with what I'm calling on. We had another session in the morning where I was saying that we can invest, we can manage to invest. Some of us who have now had this scale-up nutrition in schools for quite some time, with the help of many organizations, and I think we shared this with Namibia. But what we still have is this debt crisis. I agree with you to say that you invest $1, you gain 21. But a lot of money, for example, I hope I'm speaking on behalf of many African countries, a lot of money is being used to service debts than us investing in education and scaling up nutrition. Myself, of course, we're literally new government. We declared free education from early childhood education to secondary, all of it. So as we collect money from our own resources, we are taking to this, everything almost making sure that, especially the girl child, because usually in Africa, a girl child is disadvantaged when kids, they have to select who goes to school. If you have 4 girls and have 1 boy, a boy goes first to school. What we have actually realized is to say that whilst when we introduced meals in schools, there was an influx of kids into schools, and that lowered the absenteeism levels. But when we introduced free education, we have now seen an influx. What that tells you is to say that more than what we thought that could attract children into school, people could basically not afford to take their children to school because they are being charged. So when we said free education, now it has ballooned. We are unable to feed everyone. So because we are now sharing money, 1, it has to go to school feeding and paying for those who cannot afford. And we have seen that it has actually multiplied twofold. On one hand, we are now trying to actually employ more than 30,000 teachers. It's a cost, because now the teacher-pupil ratio has widened. And now we have to service a debt as well. It is not an excuse that we went into this debt. It was carelessness anyway. We have no excuse for that. But what I want to call on cooperating partners, otherwise the programs will not go to the desires of World Health Organization, of all those people that are doing that. If we do not campaign now to cut the date, how sustainable it will be in order for us to achieve this. And I can tell you in my country, the most disadvantaged folks are females. And sometimes you are talking about infrastructure. I've written here. You talked about infrastructure. Yes, World Bank is helping into building infrastructure. But then the kids, a girl child, because of lack of infrastructure, they are renting in suburbs, and then you find a girl is pregnant. It's quite a frustrating issue. So on one hand, as what we have said, especially the last speaker, yes, we can do that. We are using our own resources, which we are collecting, now to make sure that every child is in school, especially a girl child who is disadvantaged. But there's this now huge cost that we have to service the debt. I have to pay $430 million every month to service a debt, which of course was acquired in the most suspicious manner by a previous government. I'm sorry to say that, but these are the realities. So if we do not tackle the real problem and agree that there's a problem that we have on our hands, all these nice things that we have said may not realize what we're trying to focus on. So my current call is for all of us to get concerted efforts that the debt crisis, the debt burden in Africa is huge, which is making all these nice interventions and research which is being done not possible. So on one hand, we're trying to struggle this way. On the other hand, you have now to do this. So in the morning, I was actually calling on cooperating partners so that can we now start? Even when we go to the United Nations in September, we must start talking about it. Otherwise, all these things will not realize what we are planning to do. And I could see the last speaker, you were too emotional, which I like because everybody must be emotional about what they're trying to see and what they want to achieve. It is good for me when I listen to people who are passionate about what they want to achieve. These are the bottlenecks which we face in Africa. I'm not talking on behalf of every African, but this is where I'm coming from. This is where we have a problem. And I hope my colleague from Namibia, because I was there, we toured all those facilities, and I realized that we share the common problem. Thank you.
Thank you for sharing some of the challenges of how do we make these recommendations feasible. I'm wondering if Ms. Rojas or Ms. Steenkamp would like to respond to the comment.
Thank you very much, esteemed Honourable Minister. I think of Zambia. I think I just want to acknowledge and recognize indeed that which you've presented, the difficult balancing that many countries may face, one of not just investing in education, but investing in the health and the safety and the nutrition of the children in school versus debt. And I think it shows clear ownership and political will for Zambia to want to tackle these issues. And the fact that you brought it here and acknowledged why it happened in the first place, it's truly commendable. And I just hope that with the next 3 days or so, we will have an opportunity to learn more from each other and exchange practices as to how we may move forward tackling this issue of debt service, which we know eats away domestic resources from core priorities. I just wanted to acknowledge that you've took ownership and that we really commend you on that. Thank you, sir.
Thank you very much for your question. And yes, I'm definitely too passionate, maybe. Now, it's really interesting, the point that you made, because it's not new and it's coming from different countries. And I can say this, especially as we speak within the School Meal Coalition membership. It's the point, definitely the frustration or the financial component of it is creating a lot of concern somehow. However, the way that at least within that group we're looking at that is through the establishment of different initiatives. One of those that is led by the Education Commission, Mr. Gordon Brown, is looking at the financial mechanisms that should be identified and that could serve the purposes of supporting countries. So we're not talking about a trust fund mechanism or funding that you can apply for, but rather is actually identifying what are the financing tools and mechanisms that would be available in the different countries and contexts to which countries then can rely on or make reference to. And they consider, of course, as well, innovative financing, IFIS intervention, cross-sectorial, private sector. So how do we bring all those partners together? And what is the solution that actually applies to your specific country? So that is the way that the coalition is looking at that. Definitely, I'm super happy then to share more on that information, but it's definitely a concern that is shared with others. Thank you.
Thank you to our two speakers. Now, I know some of you might still have some questions, experiences that you would like to share. We'll have time for one last speaker, so over to you, Miss.
Thank you very much, Madam Moderator. Mine is not a question, but I really want to react to my colleague's concern, which is a real concern. But I still feel for us to run through ideas and identify priorities and identify policy options, mindful of the challenges, financial challenges that we have, should not discourage us from focusing on what is doable, while in the same vein also we are identifying, as she rightly said, funding modalities. We might get discouraged by what is not available, but the issue is also, are we really being so forceful in identifying? Because nowadays we are talking about local resource mobilizations, the issues of partnerships with the private sectors. Sometimes you look at ourselves as a government, and I'm talking about my own government. Everything must be done by government. But if we look into around ourselves and go into partnerships, possible partnerships, there could be resources lying idle there while people are looking for government to do everything. Definitely, financial challenges will not be met over whatever, but it means if we plan and we prioritize and we agree on policy options which will make an impact on the education of a child globally, definitely we will be able to do, to reach somewhere. So I'm just encouraging to say we shouldn't be discouraged by the current situation and sit back and not think of the best practices and not talk of the best practices, no matter how small difference it's made. It's still a best practices. So I'm just encouraging. Thank you.
Thank you very much. And I think that really highlights how education is truly at the heart of everything. It's connected with so many different social issues, from climate change to gender equality to nutrition. And because it's so interconnected, we need to have an interconnected approach as well. That means collaborating and building these partnerships, because that's the only way we are going to make sure that quality education is fulfilled as a right. I am now welcoming my colleague, Charles North, Acting Chief Executive Officer at the GPE, to provide us concluding remarks. Let me take this opportunity to thank each and every single one of you, as well as our dear members of the audience for attending this side meeting on school health and nutrition, either here at Unesco or online. It's been a real pleasure to moderate this event. Thank you once again, and over to you, Mr. Dionov.
Thank you so much. It's great to be with all of you, excellencies, esteemed colleagues, friends, all. Thank you to the panelists for your great contributions. This has been a very helpful and rich conversation. The message I hear is quite simple, but it's also very powerful. Children's overall well-being must be at the center of all our efforts to transform education. But improving well-being is also no small feat, as we've been hearing. Generations of children will continue to face the impacts of multiple global crises in their lifetimes. We already see it in the statistics of today, including the ones that Maria Jose has shared with us. Let me add just a few more. 73 million children go to school hungry every day. And that number will grow as the food crisis also worsens. 1 billion children live with grave climate and environmental risks and have little access to essential services like water, sanitation, health, and education. It's a wonder that children have a chance to learn at all, given those statistics. In fact, learning poverty in low-income countries surged 20 percentage points to 70% since the COVID pandemic. Therefore, a crucial part of transformation has to be rooting that effort in improving how education systems interact with health, social protection, climate resilience, and other systems. Schools are meant to provide children with learning and skills for the future, but they can also be powerful vehicles for health interventions, delivering healthy meals, life-saving information, and immunizations. We also know schools have the potential to be spaces for psychological support for children, especially in emergencies. And education is an untapped force for building climate resilience through adaptation and mitigation. So we must transform education by working together with utmost urgency, pushing bold policy reforms and innovative cross-sectoral thinking. Just this morning, as we've also heard from the floor, the education ministers on GPE's board of directors, on behalf of 80 GPE partner countries, issued a communiqué highlighting the urgency of transformation. They called for the international community to strengthen local, national, and global partnerships to support and complement their national efforts to transform education. At the heart of this ask is the call to the international community to stop working in silos. We have taken some steps in this direction. The Stepping Up Effective School Health and Nutrition Partnership saw multilateral agencies coming together for strong advocacy, data, and evidence-based policymaking for better school health and nutrition. And last year we saw the launch of the successful country-led School Meals Coalition that Maria Jose mentioned just a short while ago. GPE is also making bold strides to strengthen partnerships to transform education systems. GPE funding incentivizes country governments to work with partners, including partners from the health, nutrition, and other sectors. Together, they diagnose key challenges in education, prioritize reforms, and align funding and efforts behind country leadership to implement those reforms. In this way, health and nutrition priorities are reflected in countries' system-level efforts on education. In fact, GPE has supported 52 partner countries design and integrate school health interventions into education sector plans. School health and nutrition have also been key components of GPE's $500 million COVID-19 response. Let me just give you one example. In the Gambia, GPE funded the distribution of food to 100,000 of the most vulnerable students while schools were closed. This is a complement, frankly, and partnership with WFP that did a similar initiative in other districts in the country. We know bold policy efforts need strong financial resources, as we've been hearing. Even with back-to-back economic shocks and rising debt, 20 GPE partner countries have shown their commitment to increasing the volume, equity, and efficiency of domestic financing to education in the Heads of State Call to Action on Education Finance. To support them, we, the international community, must increase, harmonize, and align our aid to national systems. This includes policies to improve health and nutrition outcomes for children. And these are all essential for achieving SDG 4. Our efforts to transform education should not be seen just about children's survival, their existence, their skilling, or even their participation in the economy. Certainly, these are all crucial. But we also need to affirm and build dignity, psychological safety, health, autonomy, and empowerment for our children. That is true transformation. Thank you.